Hi, today we are going to dive into learning about copper. 2. Sulfate. Copper is one of the top 4 elements in the Earth's crust. It has 2 naturally occurring isotopes, which is 63 Cu and 65 Cu. It is also an active metal that can react with many substances. Copper 2 sulfate is a chemical compound with formula CuSO4. It contains copper at +2 oxidation states and sulfate ions. Also, pure copper 2 sulfate is white but turns to blue when exposed to water.
Let's see how copper 2 sulfate is produced. There are some ways to make copper sulfate in the laboratory. Copper 2 sulfate can be made by electrolysis of a solution of sulfuric acid with copper electrodes. By this, copper sulfate solution and hydrogen is produced. It can also be made by reacting copper 2 oxide or copper 2 hydroxide or copper 2 carbonate with sulfuric acid, or by adding copper to heated and concentrated sulfuric acid.
Ma'am, I've been studying about mineral deficiencies, and I came across copper deficiency. Can you explain how copper sulfate is used to treat and what kind of health issues it can cause if left untreated?
To answer your question, let's see more on this. Individuals with copper deficiency are rare, but this can lead to anemia, bone abnormalities, and hair loss. Some of the symptoms are always feeling cold, fatigue, pale skin, poor growth and skin inflammation. Copper deficiency in the blood are called hypocupremia. And yes, copper sulfate supplements can help to correct this deficiency. Copper supplements on the market include copper gluconate, copper sulfate, and copper chloride. Taking about 2 milligrams of copper per day may help to correct this deficiency.
Could you explain the mechanism by which copper ions released from copper sulfate exhibit antimicrobial properties?
Let me give a brief explanation on it. Copper ions released from copper sulfate have antimicrobial properties. All other compounds of copper oxide, copper acetate, and copper nitrate demonstrated bactericidal properties, a substance that kills or slows the growth of bacteria. But the greatest antimicrobial effectiveness for all bacteria tested was observed with copper sulfate. In general, copper-containing MPS added to many dental materials inhibits microorganisms, mainly through the release of the MPs and copper ions. The antimicrobial process of copper-containing NPS is to produce rows, destroy cell walls and cell membranes, and react with proteins and DNA 60-wane. In this process, copper-containing MPs can damage different microbial cell components through a variety of mechanisms.
Has any research been done to assess their effectiveness in healthcare settings for reducing the spread of infections? Yes. Copper surfaces and solutions containing copper ions have been explored as potential tools to reduce the spread of infections in healthcare settings. Could you elaborate on the specific copper compounds and their anti-inflammatory effects that have been researched? And how promising are they as potential treatments for inflammatory conditions?
Current interest in Q complexes is stemming from their potential use as antimicrobial, antiviral, anti-inflammatory, anti-tumor agents, enzyme inhibitors, or chemical nucleases. Markedly, the biochemical action of Q complexes with non-steroidal anti-inflammatory drug cells has been studied. Numerous QI complexes of NSAIDs showing enhanced anti-inflammatory anti-ulcerogenic activity, as well as reduced gastrointestinal toxicity compared to the uncomplex drug, have been prepared and structurally characterized. They comprise a class of potential anti-inflammatory drugs.
For hundreds of years, copper and copper compounds have been used empirically by experimenting with treatment of a variety of diseases. There is mentioned the use of copper in the Ebers Papyrus, one of the old manuscripts in the world. Copper is involved in the formation of collagen, a critical component of skin and connective tissues. Copper sulfate may aid in wound healing by supporting collagen production. The synthesis of collagen is quite complex, but a key enzymatic reaction involves copper and the enzyme lysyl oxidase. Lysyl oxidase catalyzes the formation of aldehydes from lysine, residues in collagen and elastin precursors. Being highly reactive, they undergo spontaneous chemical reactions. This action forms the basis of cross-linking between collagen and elastin, an essential process for stabilization of collagen fibrils and elasticity of mature elastin.
Copper sulfate is a versatile compound with a long history in medicine, and it has anti-inflammatory and antimicrobial properties. However, copper sulfate can be toxic. so it is important to use it carefully and only under the guidance of a qualified healthcare professional.